Okay, so good afternoon, everyone, and welcome to the Brainy Boomer Lecture Series. I'm so very happy that you've joined us all today. In 2007, the McGill University Research Center for Studies in Aging, or the MCSA's Education Committee, started the Brainy Boomer Lecture Series in order to suggest practical steps to both improve and maintain brain health, as well as to promote healthy lifestyle choices amongst the most populous generation in history. The MCSA's Education Committee, which was founded in 1996, has three main objectives: identifying education needs of healthcare providers, seniors, caregivers, and the public, and to develop responses to meet some of those needs; to enhance the positive image of the aging process by addressing stereotypes and myths about aging; and finally, the dissemination of research on aging. Salvatore Cimino has worked in the information technology industry for over 30 years. He is Vice President of Claridion Incorporated, a consulting firm of experts specializing in monitoring and management of critical technology infrastructures. He is also the Vice President and co-founder of AIoT Canada, a nonprofit organization dedicated to the development of the Internet of Things and artificial intelligence ecosystem in Canada. Salvatore is a strong believer that technology must also serve a social purpose. Many recent advancements in connected sensors and data analysis are accelerating the development of solutions to improve the quality of life of the more vulnerable segments of our society. Before continuing, we would just like to remind you to please mute your microphone on Zoom, and that if you have any questions, please wait until the end of the conference, or you could write them down in the chat box on Zoom. And now I'd like to invite Salvatore Cimino to start his presentation, COCOON, Smart Technologies for Safe Aging.
Thank you, Kathleen, and really thank you all for attending this lecture. If we were in the same room, and boy, do I miss those days, what it is, I would ask you a question, what it is that we talk about when we speak of technologies for aging safely. I've been in technologies for forever, and I think technologies are a means to an end. And throughout this presentation, my point is that I would like to talk about what it is that us elderlies need so that technology can help us on our path to a safe aging and healthy aging. So without further ado, I would like to click on a button and see if it works. So I'll talk for a moment about what's the demographics in Quebec, the situation, the demographics in Quebec are. From the pie chart on the screen, you will see that basically we have evenly, these are from numbers from 2016, and they're changing fast. But right now, we're about even in five areas, five segments, from 0 to 18 years old, 19 to 35, 36 to 50, 50 to 65, and the over 65. We see that it's about 20% each range. So we can assume that it's about between 50 and 60% of the population that actually works. The rest is either too young or too old or retired and so on. So this is the situation that is, as I said, is changing fast. By 2030, it's around the corner. In 10 years from now, the number of deaths in Quebec will begin to numbers the number of births. We'll have some immigration, of course, and as you can see in Montreal area, maybe northern Quebec, we will see still a little bit of demographic increase, but generally we will be short. And will start to decrease as a population overall. And so we'll see that the productive group will actually drop. And in 10 years, will probably drop about 8%. It is projected that within the next 50 years, the over 85 population, part of the population will explode. So we will basically, threefolds, fourfolds from now. So what does it mean? It means that we're going to have a silver tsunami. The gray haired population will be really will be everywhere. So and we'll have needs. We baby boomers. We are expecting to live a long and productive life even in our older age. So it doesn't take a brainy boomer to understand that the older we get, the more healthcare we require. And Canadians over 65 already, and again, these are numbers from 2016, the over 65 already consume about 44%. So the 20% right now, about 20% of the population consumes about 44% of the budget, healthcare budget. You may see the curve there. Some of the dips are probably due to the healthcare cuts in different with different governments, but we see that there is an increase, and the increase is due for so many reasons. Technology, machinery, a lot of research, but also because the cost is just increasing, inflation is increasing, and the population is getting older, and thus needs more healthcare. The other problem is also the labor shortage. We already mentioned the demographics, and we will end up with a growing nursing shortage. So the people that will have to take care of us will be less and less, and we'll need to do more with less. So with the current policy intervention that are in place, will definitely be short. We are short already. With the current pandemic, I was reading a few months ago that they hired a lot of uh, orderlies, and they trained them. So maybe at least this was kind of a wake up call, and hopefully um, that this particular issue, the labor shortage, will be addressed somewhat. But the problem is that we will actually fight all over the world to get the people in place to help us and keep safe in our old age. So there is a few approaches, and what can we do to make the task easier, even for the nurses, for the medical profession, for the aging population. So we should, as possible, we should be able to promote healthy aging. So if we keep the older population healthier, well, they will have a less of a burden on the society. The health services that should be in place should not be only for reacting to major problems that we just discover. We should be able to discover the problems before, as soon as possible, so that they don't get as difficult and to fix later on. And also the environment, that the society itself should be age friendly, and that means that services should be a little bit more appropriate for what we're up against. We have to do our parts ourselves. We have to do our parts. There is a safe living guide. Let's put it in place. The older we get, we have less mobility, so our sight is not as good as it used to be. So we fall easily. As you know, this is a major issue, falling, and so we can put in place simple things, grab bars, non-slip surfaces, ease of reach, lights, railing, remove the clutter, having an easy access to emergency number. So these are the things that we can put in place, and the family, our environment can help us put those in place. Things that we can do. I think one of the things, you guys are in on this video conference, so that means that you can use already a bit of technology. You keep your brain active, and that's the best way. I'm not a doctor, but I believe strongly that if you're active, and keep your brain active, that helps a lot. And I would think it would help against depression, which is a major issue with when we get older. We are a little bit more isolated. Uh, this pandemic is having a toll on that as well. How do we connect with caregivers, family or whatever other services that we can use? And also, I think it's preparation is half the battle. Uh, you know, if you stop working and you don't know what to do with your retirement, well, this may be a problem regarding your activities. So financial security is just one part of the equation. Uh, so what's the timeline usually? You are an active adult living normally your life, doing all kind of things. Then maybe you retire, but you're still independent. You travel, you do all kind of things. Then we go into the phase where we start needing care. Uh, and we go to assisted living, long care. This is where the continuing care and the home care kick in. This timeline is different, of course, for everybody. Different people have they need the assisted living before or after. But this is probably one of the places where we can uh, have the most impact on the cost and the burden on the healthcare. The When you end up in a assisted living, so in a CHLSD, uh, that the cost of a CHSLD LSD is taken, about 80% of that cost is taken up by the state, by the government. Uh, and so it's about $90,000 a year that cost society to keep us in a CHLSD. If we stay at home, and we usually prefer that unless we really need that, the assisted living part, it would go down to about $15,000 a year. And so it's a huge impact on the cost on the society. So what we can do to stay at home as much as possible. And this is where technologies come into play. But first, we have, most of us have some of these fears: loss of independence, declining health, running out of money, not being able to live at home, death of spouse, inability to manage their own activities. We lose our driving permit. We end up in isolation. We have strangers that we do not know giving us the health care that we need, but there is no rapport, and there is also fear of we are fragile, basically, so we fear of getting hurt, and that there is a revolution in play right now. There is indeed technology is accelerating at an incredible pace. What can technology can do for us? There is these are a few things. Some of those, I'm sure you guys know many of these devices. So we have personal alarms where we can panic buttons, auto administration therapies, tracking our data. You know, there's smartwatches, a smart bracelet that can log information that can then be used by yourself or by your caregiver. We have to say that the boomers are very familiar with technology. 80% of 85% of the older boomers have a cell phone. They have a desktop. They have a laptop. They use the internet quite a lot. So it's not bad. The picture for the elderlies and technology is not that bad. We are familiar. We're not afraid of that. AI and IoT. You may not know these one of these acronyms. AI, of course, is artificial intelligence. We use that term loosely because real artificial intelligence, I want to say clearly, it doesn't exist. It may not exist ever, but we have something that resembles artificial intelligence. The other acronym is IoT, is Internet of Things. And the Internet of Things means connected devices. So something that is connected to the cloud. It's important that that we understand is not just connected locally, has to be connected to the cloud, where the AI can use the data to analyze. So the artificial intelligence is revolutionizing healthcare, elderly care. I guess you can see that I have a little accent. Healthcare providers are starting to offload certain parts of the analysis, the automatization. So there is devices like at home health monitoring, smart devices that can the virtual companions, the anti-aging research that there's research that is analyzed by an AI that finds new ways of using that research or new path to go on with that research, and this is extremely interesting. There is artificial intelligence is used for recognize your voice and your commands. I mean, many of you probably use the iPhone Siri or the Google and Alexa assistant. I mean, this is already. I mean, you can ask Google or Alexa to do an emergency call, and they can actually understand. So there are devices that can understand if you fall remotely. You do not even have to wear something on you. There's behavior analysis. This is something that is happening. Is really going on, and there's a lot going on this domain with proper sensors, either sensors that you wear, sensors that that are in your environment. You can analyze the behavior of the person, especially in a person that is often in isolation and maybe get visited by family or a home care service. They don't get monitored on a regular basis, so they don't see exactly that their behavior is declining. We can have something that can actually analyze your behavior, the way you move around the house, the way you access some of the appliances. So just by the sound of your walking, They can analyze your gait. So if you're having some problems walking, they can analyze if you're having an unusual behavior, so that you can, if you if you become forgetful, there are ways to analyze that, and kind of an alert or a warning can be sent to the caregiver saying that something is changing in the person behavior, and this could be extremely important for detecting early cases of mental decline. Uh, there is real-time interaction. Again, we do not have that many resources, real resources, people. So the more and more you can get, you can actually talk to to a software, and they understand you. You can express your pain, you can express your feelings, you can express any other information, and that can be analyzed, and then a real person, a real doctor, whatever, your caregiver, can be alerted so that you can be assisted. uh, and this can work very well, again, to to um, to give uh, even people with really heavy mental decline, maybe that those people can still talk to somebody, even though that somebody is not real. Digital companion. This is very is used a lot in Japan. In Japan, they're strong on that. But loneliness is as dangerous as smoking. It gives you much higher chances, a risk of dementia. So it's a real issue. So that's why loneliness kills. For seniors, it can be as bad as obesity, smoking, and alcoholism. So there is quite a few companions. These are real products, and it's just a small part of what exists. As I said, places like Japan, they use this a lot. Just having, even though the person understand is not a real living being, still it's something that they can interact with, and these systems, these robots, can actually respond to your changing moods, and do something about, alert somebody, or just motivating you to get up or to eat, to take your pills, and so on. Fall accidents, of course, is, you may already know, it's one of the leading cause of fatal and non-fatal injuries. And there is several possibilities to either compensate for that. Sometimes you fall and you cannot get up and there is nobody around. So maybe you can push a button and alert someone. But sometimes you're not conscious or confused, and you don't know that you have to push a button. So there is a few things. Some of you may have the Apple Watch, which detects a fall and call a number. But you have to wear these kind of things. You have to wear them. You have to have a charge so the battery is not dead, and so on. But you see, for example, that square thing on the screen. This is a wall device. It's just attached to a wall and detects people, the sound. By the sound, the vibration detects a fall, and can, so you do not have to wear anything. So you get your, that's why I call the presentation cocoon. So you create your cocoon that protects you, if anything happens. Biometric data analysis. So you can have sensors in pillows and mattress that provide info on your quality of sleep, wearable sensors that collect temperature, heartbeat, blood pressure, face recognition, and mood detection. As a matter of fact, there is something that can learn how to detect your mood. So let's say you get up, you go in to the bathroom, or you wash your face, and the mirror can recognize your mood, and maybe uh, there might be some positive feedback to help you out, or even again, warning and alerting and logging that information for future analysis. I mentioned before the gait analysis, so you can, the way you walk, and so that's where the should I say the AI can get into the equation. There is I'm talking about a lot of sensors. You notice I didn't talk about cameras because a lot of the time we do not want the cameras are a little bit video cameras are intrusive. We don't want to have somebody watching us. However, some cameras can actually be operated by an artificial intelligence software, so there is nobody watching. The camera just there to see if you're walking correctly. If you fall, it can detect if you fall, and so on. There are other things like again, stuff that is this technology has to become affordable, and this is happening. I may show you a little device. For example, this is a simple. It's a small microcontroller that costs only a couple of tens, $20, and microphones, temperature, and you can imagine you can teach it to recognize cough, for example. If you're coughing on a regular, too often, or during the night, you're been coughing all night, so you're having, with the sensor under your mattress, you're having, we recognize that you're having a very difficult night, being a little bit sick, or, getting up too often, coughing. You can imagine with something like that, you can, somebody can be alerted, and it can be alerted a little bit sooner than later, where it becomes a little bit more difficult. And so that's what we would like to have. I mean, we have all this. I mentioned all these sensors, all these possibilities, but what we need is the packaging of all this, and this packaging should be affordable, should be also accessible. The the government should also, the society, I would say, government it should also give programs for this, so that everything is packaged properly, so that the service, we have to use that technology for for the end, which is our well-being and our protection, and it should be invisible, should be it should be integrated in the services that are given by the healthcare industry. This is what is missing right now. This is something that I feel it's really missing, and we should work, and we should demand this approach. It's the technology is there. We just need to create the programs with it. So to recap, these technologies can help us managing the chronic health conditions, falls in activities, medication, give respite to caregivers, and your family can have a peace of mind because your family cannot be with you 24 hours a day. Safety when you use appliances. If you're confused and wonder, well, there should be ways of protecting you even outside the home. So I think the cocoon should follow you even outside, and of course, falls and which happens often during a bathing and or in the kitchen. These are we can have devices that can help us with that. I went pretty quickly to leave some time for the questions, if there is any. Also, not to waste too much of your time, but let me know if you have any question.
Yeah, thank you so much for that fantastic presentation. So yeah, are there any questions for Salvatore? Okay, so we'll just wait a minute.
No hands up?
No hands up yet. Any questions?
I have a comment, if I may.
Sure.
Great.
One of the things that when we talk about coming into any period of our lives, I think there's something called prevention. And the adage, an ounce of prevention is worth a pound of cure. So I think one of the things that I would like to know more about is how do we prevent some of the issues that as we age, and we all know that we are going to have issues, what are ways that we can use to prevent them? And are there technologies available that would enhance that process?
Move over.
Yeah, I hinted at that by mentioning that I really, really would like to use these technologies to at least have if not prevent, at least have an early warning. And that's prevention. We have to take ownership of that too. We have ourselves as individuals. We have to do certain things, as I mentioned. Being active with our brain and our body. But you're right. My point on my presentation was really for not too much for prevention, but for early warning. This is the part that myself I'm a little bit concerned about it. I'm on that, at a certain age where I only get older every day. So I don't know when I'm gonna need some help. But if like any human being, it's a human nature. We if I feel a little bit strange, I'm not going to the doctor usually. This is usually what we we often do, and maybe those are signs. I'm Each person is the worst judge often of our condition, and by having an objective observer 24 hours a day pointed at us, really looking at us and seeing how we behave. I'm one of the things I'm scared the most is my brain decline, so my mental decline. It's something that is so subtle, so difficult to discern, and sometimes it's too late. And usually, maybe the people at McGill Center of Studies for Aging can tell me how many times is not really the person that comes to see those doctors, but it has been brought to see the doctor by somebody else that has looked at that person and seen that is declining. That's what happens. I think that's what happens all the time. Again, this is my own experience. It's just personal. But so this is what I'm afraid of, is that we don't see this happening, or we see it when it is a little bit too far gone, and that's what my early warning package that I would like to see would come into play.
Perfect, thank you. We have another question here. Someone would just like to know if all the devices that were discussed in your presentation, if they're available right now.
They're available. I mean, I don't not sell any of those devices. I usually get involved into deploying some of these technologies, but the actual devices, yeah, those are actual pictures. Some of them actually, they probably even obsolete. There's some new ones. For example, there is a little company here in Quebec, as a matter of fact, that they developed a bracelet that can take about 10 vital signs, you know, like the pulse, the blood pressure, temperature, of course, and even oxygen saturation. This, for example, is something that you wear on yourself. There are some devices where you just stick your finger in there and they take the blood pressure, saturation, but take about 15 vital signs. Again, all that information can be sent out to a service that can then use them. But that's what is missing. That's what I just said. You know, it could be sent to a cloud service, but I found that I was looking in the last couple of years. I've been looking. There's not much in Quebec that is happening. There is a lot of devices. There is all separate devices. There is, for example, a device for your stove, which can actually even turn off the stove from remote, but it could give that information to somebody, somebody in your family or your caregiver that knows how long you've had your stove on. If it is in the middle of the night and the stove is on, you can get an alert. So you have all these devices are available. They're not integrated in a overarching package. This is what I'm actually upset about this, because we should have it. We should have it. We have everything. It's like Steve Jobs had all the technology. Steve Jobs was not a technology guy. I mean, he knew technology, but he did the perfect packaging when he created the iPhone. Everything was already there. He just put it together, and it became something. He changed the landscape about the smartphone. So I think we're at that point. We are at the point where technology it's fairly mature, but we have to put it together. It's all spotty.
Perfect. And this question kind of goes off of the last one a little bit. Someone would just like to know, how accessible are these technologies today, and what are the best channels for evaluating them?
There is a couple of sites. Again, there is no support to put them together. It's and I'll talk in a bit what we're trying to do in that sense, you know, personally, me and my colleagues. But there is some sites, for example, one that came on the I think it was on Journal de Montréal. There's a site called Ugeria, which gives you all kind of products, and you can buy them. You can buy a large clock. You can buy, you know, a pill dispensers. You can buy the stove switch and the plug. You can buy all these kind of things. You can buy radios, you know, specialized, you know, simple to use. So, but there's no service around it to integrate all that. In my bio, Kathleen mentioned that I'm the co-founder of an organization, nonprofit organization called AIoT Canada. AIoT being an acronym that put together the artificial intelligence and the Internet of Things together. And the idea is to really develop the ecosystem here in Montreal and across Canada. We do have already connections with Alberta, Ontario, and the idea is to really, Internet of Things can be the key to give us the information that we need. Right now, the Internet of Things is usually used mostly in industrial settings, you know, for machines. But I think we should use IoT for humans. And once we have these sensors on us that can really pick up all these vital signs, and we can put them together, and we're gonna have a huge amount of data coming from that those sensors. We absolutely need artificial intelligence for that to do the first analysis of the data, so that then when my doctor sees me, he has already a picture of what I've been you know, what has been my situation for the last month, for example, for the last 6 months, or for the last year since the last time I saw him. So that's my my dream. That part is not there yet.
Perfect. So we have an interesting one here. It says, when do you think we'll have robots to look after us in Canada as Japan has now?
As a matter of fact, you can buy some of these robots already. It's you know, they change all the time. You know, there's sometimes it's just show off of technology, but there are robots that are available mostly in the States. There's not much built in Canada. That is not to say that Canada doesn't create and develop technologies. It's just that most of the time they sell it in the States and they do not sell it here, or they try to develop a business in the States more than in Canada. But Montreal, for example, is it's a technology pole for artificial intelligence. The Canadian government created the supercluster for artificial intelligence development here in Montreal. So there's a lot being developed here in Montreal. In terms of there's a lot of know-how, and basically with the IoT Canada, that's what we're trying to do. We're trying to bring together all these players so that that we can create that synergy that is needed here. As I said, you know, the States are the big markets, but you can buy these. As I said, you can buy these little robots. Not all of them. I mean, many of them are only available like phones. You should go to Japan, and you're gonna see that you're going to have 1,000 type of phones, and here we only have, I don't know, 50 types. You know, just to there is a huge difference in that sense, but that is not to say that you cannot get something here. Robots. To answer the specific questions, there's a few robots that are available that can be sold, yeah, mostly from the States, but you can get them here.
Perfect. So someone would like to know the name of the company that has the bracelet. I believe that you referred to earlier, the QUEBEC company.
Yeah, it's called Vital Tracer. We know the lady, very nice. They're engineers. They came from Ontario, and they established themselves in Montreal. It's called the Vital Tracer. Oh, sorry, Vital Tracer. Yeah, I think so. Yeah, it's one word. VitalTracer.com.
Perfect. Okay, and we have another one here. So it says, many of our elderly population are in senior residence and long-term care. Do you see these technologies, i.e. AI and IoT, becoming an integral service provided within our senior residence and long-term care to make up the lack of nurses and caregivers? These would have gone a long way in preventing what we've witnessed within our CHSLDs with COVID.
Can we go all outside and start protesting that you want that now?
Yeah.
because yes, I wish it could be done. We need, strangely enough, even with the technology that is developed in Quebec, we are a little bit, or sometimes even a lot behind the times. Europe is much more advanced in that regards. There is artificial intelligence that has been put in places like some nursing homes, and that's in Europe. Here, no, I haven't seen anything. My experience, of course, I do not know all of them, but I've been doing some researches. Nursing homes, they have nothing so far in that regard. And besides maybe, I don't know, locking the elevators for, if they have a floor for dementia or Alzheimer patients, they have some technologies to lock the floor, but they do not have anything on the patients themselves. The home care services that I've looked at and I've tried to see as many as possible, they also do not have, they only supply bodies, nurses to caregivers that come to your house and maybe take your temperature, your blood pressure, they take some information, and that's it. There is nothing remote. There is nothing to really. I wish if the nurse comes to my house, I wish he would have already all the information that she needs already beforehand. She doesn't need to come to my house and take my blood pressure. She should already have it. And she should already know that we have had a bad week or whatever. So this is what I would like to happen, but it's not there.
Perfect. So we do have another question from D. Burku.
Yes, hi.
Hi, perfect.
Hi, I'm sorry I came in a bit late. I apologize. I got mixed up with my schedules, but I wanted you to have a face to put on the message, because I'm going to send you something. I'm a city councilor in Côte Saint-Luc, and we worked on a smart city initiative where we packaged everything together to the seniors live at home safely with technology. And that was part of our $10 million proposal. I don't think it requires $10 million, but it definitely does require a packaging and an onboarding for seniors to be able to know what kind of technologies are available and to be able to communicate, with social services, health services, etc. So I'm going to be sharing that with you, and I hope that eventually we can, launch something, because I know that there's a lot of money available now from different levels of government, especially in this COVID era, because of the isolation of seniors. And there could possibly be some, possibility of relaunching that proposal.
I appreciate that there is some willingness to look at that, because I mentioned very small, very fast. you know, when I talk about the cocoon in the house, but again, the cocoon should follow me outside. So the smart city should also be
Right.
smart for that part. I mean, there is, if we go into smart city, there is so much to talk about it, and
Right.
and we go into the industrial parts. There's so many, but if we talk about the social part, and when we have a 20 and going into 25% of the population being old, it's not insignificant. We
Right.
have to look at that, and unless we say, okay, let's get rid of them, but I don't think that's the that's the optic, right?
No. On the contrary, we have so many social services like the CLSC and others that could benefit from all these technologies so that they wouldn't have to
Absolutely.
all of the real, on-site visits, but actually have virtual visits and virtual monitoring, which is very, very important. We're witnessing right now in our own city. So thank you.
Excellent.
I will definitely send you something, and I appreciate your talk, and I look.
And is Kathleen sharing my email? I mean, by all means, you can share it to anyone that wants it.
Okay, thank you. Thank you very much.
Okay, so are there any other questions? Okay, we'll just wait a minute. All right. Well, thank you so much, Salvatore, for that fantastic event. The members of the MCS Education Committee would like to thank you and everybody who registered today. Our next event is going to be on Thursday. It's from our senior exercise program with Juliana at 1:15. It's going to be a good one, so I hope you guys register for that. Down in the chat box on Zoom, I've put the link for our up and coming events if you'd like to check those out. There's also a link for a brief survey. We'd love to hear any feedback you have on today's event or any other Brainy Boomer or Health Month event that you've attended. And if you've missed an event and you'd like to watch it, I've also put the link for our YouTube channel in the chat box, so you can watch at any point. So just thank you guys so much again, and I hope to see you at our next event. Have a good day, everyone.
Thank you. Bye-bye.
Bye.